Hey, shalom, shalom, all praises, honor, glory goes to Yahweh, Bahashem, Yahushai, Bahashem, Rachak, Wadash. Double honors to the apostles, Elder Bishop of the Great Millstone, who rule well. Peace and blessings to you fellow brothers, pushing out this word in truth and sincerity. Coming back with another lesson through the spirit and power, Yahweh, Bahashem, Yahushai, Bahashem, Rachak, Wadash. And, spirit is on me to, talk about, pretty much herbal medicine. So maybe we'll call this like another herbal class, trying to be, try to stay diligent with, these herbal videos. Yahweh Shemal Shai willing, I could do more, when the spirit allowed. But this is a topic that I kind of want to speak about, dosage and duration. Dosage and duration as pertaining to a herbal remedy. Because most of us will look at a herbal remedy, will do research on a particular ailment that we're dealing with, and we'll start to do it, and we may have a little bit of success. You might think it's working, you might not think it's working, or it might have got you to a point to where you started to feel a little bit better, and then you stop, okay, and then your ailment comes back, or the issue comes back, whatever it may be. Again, this is not medical advice. I'm not a doctor. I'm not here to treat any disease or your symptoms, nothing. All right, this is just for educational purposes as far as herbal remedies are concerned. Let me open up with a scripture before we continue. This is not going to be a long video. This is just something that I've noticed, okay, why most people are not successful when it comes to dealing with particular ailments. Now, there's other things that are involved, but most people are not successful with dealing with certain ailments because the dosage is wrong, okay, and the duration is wrong, okay. Just to keep it basic, we're just going to keep it basic. So this is Sirach 38 and 3. It says no, not that one. Right, 38 and 4. It says, the Lord, Yahweh Bashem Shai, has created medicines out of the earth, and he that is wise will not abhor them. Now it's like, okay, what do I do? Does it work? Does it not work? A lot of the research, when you go online and you search for a particular, the benefits of a particular herb, or, herbs that help with a particular issue that you're dealing with, and you'll have conflicting evidence. You have, on one side of the research, it says that it doesn't work. There's no studies that prove these things. And then on the other side of the research, it pretty much tells you that these things work. So it's like you're conflicted. And that's Satan. Okay, that's Esau Edom sowing in that doubt. Okay. He'll also say that you can possibly die. There's a side effect. Your liver might go out. This might happen. That might, which a lot of times is false. But of course, you want to ease on the side of caution when dealing with anything, really. So you want to start with the lowest dosage, and then from there you want to move up. This is how you tackle that issue. But what I've seen in my just little experience dealing with the herbs is most people are not going to receive the benefit from that herb because their dosage is wrong, okay, and their duration is wrong. Now, you also have to consider that a lot of these herbs are also nutrients in food, and they're deemed as what is called a tonic. And a tonic is something that you take pretty much on a daily basis to receive the benefit. Like, a ginseng, there's a tonic dose for ginseng where you take a little bit of ginseng, just a little bit, not a lot. You take a little bit of ginseng every day to help the body function. Whatever ailment you may, it may be testosterone, it may be just strengthen the whole body, digestion, whatever it may be. These herbs work, but your dosage is wrong and your duration is wrong. Okay, now when you're dealing with any type of ailment or anything like that, right? You have a remedy. Right? Say you have a remedy. Just say you have a lot of gas. Let's just use that for example. You have a lot of gas and a lot of bloating. And you do your research and you see that peppermint is good for bloating. Fennel is good for bloating. Ginger is good for bloating. Fenugreek is good for bloating. So on and so forth. Dill seed. Okay, so many different herbs are good for bloating, and you have this problem after you eat. You have bloat, so you'll go and you'll do a ginger tea, or you'll do a peppermint tea, or you might even do a tincture, and you might receive some of the benefits. You might start feeling, oh, okay, I feel a little bit, I don't know, it doesn't fix it, but you say you've only done it for a week, and then what happens is you stop. Now this remember, your issue mainly, first you got to figure out, is it chronic or is it acute? Meaning acute is like you just caught a cold, right? You take certain herbal remedies for a cold and then it goes away. You don't have to keep up those herbal remedies because it's acute. It came for one moment and it's transitory. But if you're dealing with a chronic issue, okay, I'm not here to treat anything, I'm just letting you know. If you're dealing with a chronic issue, you're going to have to continue, okay, that herbal remedy for a longer period of time. So you can at least go 6 weeks. If you're dealing with any remedy, you want to at least go 6 weeks of constantly doing it daily, whether the dose is 1 time daily, twice daily, or 3 times daily. You got to figure that out, okay? But you have to work with the medicine. They call it working with the medicine. You got to work with it. You got to use it. You got to actually do it every day. Now, the best way to do it really is 6 days on, 1 day off. Okay, 6 day on, 1 day off. So, for example, you're dealing with a lot of gas, you're dealing with a lot of bloating, a lot of tightness. Say you want to use ginger for that. Well, if you're making a ginger tea or your ginger shot or a ginger tincture or the powder or the capsule, whatever it may be, you have to be consistent with that dose. Now, say you're consistent with that dose, say 2 weeks, 3 weeks, 4 weeks, 5 weeks, right? Let's say 4 weeks. You're consistent with that dose and you receive no benefit. Okay, you don't really feel anything. Well, either you could scrap that remedy and go somewhere else, or maybe your dosage was wrong. Maybe you need a higher dosage, right? So then you increase your dosage, okay, and then you go several weeks, okay, a couple more weeks to see if you feel that benefit, which the herbs actually work. Again, it's a case of the dosage is wrong and the duration is wrong. A lot of these herbs are long-term herbs, okay, meaning you take a little bit of it daily. So this means that you have to incorporate that into your life. So for example, ginger, you must pretty much drink the ginger or the ginger tea or the tincture. You got to take that daily, or in order for you to inherit those benefits, because the herbal medicine works, but it doesn't work like when you go to Esau, here's a pill, it's going to drop your blood pressure down, this and that, and that. It doesn't work like that. It goes in and starts to correct the actual issue of the body, and that takes time. And most people are dealing with issues that they've had for years. So even if you did it for a month, that doesn't mean that it's just going to correct itself. Okay, then again, your dosage can be wrong. So working with the dosages, start at a low dosage, okay, and then increase the dosage as you see fit. But you must work with the medicine. You must work with the remedy. Okay, you can't just do it a little bit and then expect that whatever ailment that you have just to go away. No, this has to be a part of your life, whatever it may be. Whether it's a peppermint tea daily, maybe you drink a peppermint tea after after you eat, to help with the gas, to help with the bloating, to help with the circulation, whatever it may be. Cayenne pepper works. All these herbs around us, aloe works. Okay, you have stomach issues, right? You have constipation issues. Well, if you just take the aloe gel, you just take a little bit, a few times, and you expect it just to correct your constipation. Okay, you're out of your mind. And then what happens is you don't get the results that you want, so you just stop it, and then you just go back to what you're doing, and then your ailment just compounds, and you just feel even worse. But the remedy is right there. So if you were taking aloe, you got to get the right dose, maybe 4 ounces, daily. Aloe takes at least 3 months to start working. I mean, you can feel it initially. You'll get the short term benefits, right? There's herbs. When you take a herbal medicine or a remedy, there are short term benefits, meaning you're gonna feel certain things short term, okay? But then there are midterm and then long term benefits that you don't even actually receive, okay? Because you don't take that herb. You're not really taking the herb. You got to take it. Okay, so if you're taking aloe for constipation, for digestive troubles, okay, to increase appetite or to reduce inflammation in the stomach, you got to take that daily, okay, in order for you to receive that benefit. And this is just something that I've noticed, okay, and I experienced too, not actually receiving the benefit that we want to that we want to receive when we're dealing with a particular ailment. Now, it could be that you need multiple remedies to figure out what's going on or to correct what's going on, but nevertheless, you must still have the right dosage and the right duration. Okay, so I didn't want to make this long. Just something to think about when you're dealing with the herbal remedies. I know brothers deal with herbal remedies. Sometimes you have success, sometimes you don't have success. But I just want to kind of push that spirit out there that a lot of times you don't get the success. Okay, not all the time. Okay, but a lot of times you don't get the success because your dosage is wrong. Okay, and your duration is wrong, meaning you're not taking it long enough. And again, a lot of these herbs are long-term herbs. So the best strategy is to actually start to incorporate these things into your life daily. And this is actually our history. This is our heritage. We understood about these things. We took ginger daily. We took garlic daily. We took turmeric. That was incorporated into our diet. That was incorporated into our life. We took digestive bitters daily. If you have stomach issues, you should be taking a digestive formula every day. Okay, pretty much until that issue is corrected, because it takes time for these things. The herbal medicine is actually correcting the issue. It's not masking the issue. If you want to mask the issue, go to Esau. Okay, he's gonna give you a pill. He's gonna give you some a pain pill, but the issue is still there. If the moment you stop taking it, the issue is there. Now Esau, he'll give you, okay, this is for your blood pressure. He'll tell you that you must take that forever. Right? And you will blindly just do it. Yeah, this is just what I do. This is just what I do. Well, bring that same mindset to the herbal medicine side. Okay, that has less side effects, almost non-existent. They are there, and you must do your research on particular herbs, because there are low dose herbs, and then there are other herbs that are high dose. Now, you don't always need to be the most powerful herb, the most the strongest. It's not about that, because these herbs go into the body. They have many functions that they do. They just don't do one thing. They have many functions, and they actually start to bring the body back to balance, whatever issue that it may be. Like ginger root. Okay, you taking ginger root tea every day, or you eating a little piece of ginger every day. Okay, that's going to start to rebuild your digestive system, start to move gas out of the body. Okay, but I didn't want to make this video about the different properties of different herbs. I just wanted to focus in on just what I've been seeing and how to be more successful when you're dealing with a particular issue. Because a lot of issues that you're dealing with, that you're trying to correct with the herbs, they're chronic issues. These things been going on for a very long time. Okay, so you need to really change a mindset of, okay, I got to take this daily. This is something that's just part of my life. You drink water daily. Hopefully you drink water daily. Or you eat food daily. Well, this is part of the food. This tea that I'm drinking. I drink tea daily. Okay, you have people that drink coffee daily, right? Well, switch that out, okay, for a particular blend, whether it's for your nervous system, for anxiety, whether it's for digestion, whatever it may be. And then you got to work with the dosage. Work with it. Start with a low dosage. Okay, and then every day, 6 days a week, 1 day off. All right, and this means you have to be consistent. Sometimes you miss the day, sometimes you miss. That's okay. That's totally fine. All right, and then if you're receiving too many you're getting a side effect. For example, if you just take a whole bunch of chamomile tea, well, it's going to make you sleepy through the day. You're going to be drowsy a lot. So what do? You taper off that dosage. You go to a lower dosage. You see what I'm saying? So I want to just close it there. That's my observation. I want to keep rambling on, but just again, I always do this. I just reiterate again. Okay, it's about the dosage and the duration. Now, there's a saying in herbal medicine. All right, ancient physicians, the poison is in the dose. Okay, and the healing is in the dose. Okay, until next time, shalom to the left.